Good evening, students. Today I am going to talk about anti-tumor antibiotics. So anti-tumor antibiotics are one type of anti-cancer agents. So what are the drugs in this group? We have anthracycline antibiotics like Doxorubicin, which is also called as adriamycin. We also have Daunorubicin. We have epirubicin, idarubicin, Mitoxantrone Bleomycin Dactinomycin, and mitomycin. I am going to describe each drugs one by one. So at what point of cell cycle these drugs, anti-tumor antibiotics, are acting? So all these drugs are acting at G2 phase. Okay, G2 phase. So all these drugs are CCNS drugs. That means cell cycle non-specific. They act both on the resting phase as well as the proliferating phase, except the bleomycin, which also acts in the G2 phase, but as CCS phase, cell cycle specific phase, which acts when the cells are only proliferating but not at the resting state. So you can understand the concept. All these anti-tumor antibiotics, they are obtained from the bacteria called Streptomyces. Okay, Streptomyces. So important mechanism of action of the anthracyclines is they act by inhibiting the enzyme called topoisomerase 2. So what are the uses of Doxorubicin and Daunorubicin? They are primarily used for acute leukemias. So acute leukemias are AML and ALL. Acute myelogenous leukemia and acute lymphocytic leukemia. For these conditions, for acute leukemias, these drugs, Doxorubicin and Daunorubicin, are used. So what are the uses of idarubicin and epirubicin? They display the broader activity against, remember, BOES, okay, BOES. So BOES, B for breast carcinoma, O for osteosarcoma, E for ewing sarcoma, and S for soft tissue sarcoma. First one is breast carcinoma and others are related to soft tissues and bones. So osteosarcoma is a malignant tumor arising from the bones. Like that, soft tissue sarcoma, the malignant tissue, the malignant cancer arising from soft tissues. Okay. So now I'm going to talk about the important side effects of anthracycline antibiotics. The important side effect you should remember, that is always cardiotoxicity. Remember cardiotoxicity, because these agents, they generate the free radicals called semiquinone free radicals. So they are responsible for cardiotoxicity. This cardiotoxicity is manifested in the form of dilated cardiomyopathy and congestive heart failure. So important side effect is cardiotoxicity because of generating, these drugs will generate semiquinone free radicals. Remember that point. So how will you prevent this cardiotoxicity of anthracyclines? We can give antioxidants like alpha tocopherol. And another important drug which is important in MCQ point of view is dexrazoxane. Dexrazoxane is a free radical scavenger. Okay, that can prevent the complication of cardiotoxicity of anthracyclines. So you should give antioxidant like vitamin E, that is alpha tocopherol, and dexrazoxane. It's a free radical scavenger. So nowadays we have novel formulation of anthracyclines, that is liposomal formulation of these drugs. They have decreased cardiac toxicity. So remember important points. Thank you. Now coming to, I told you it will produce the cardiotoxicity in the form of dilated cardiomyopathy. So if you're going to talk about the dilated cardiomyopathy, it is cumulative actually, and it is dose dependent. And even after discontinuation of the anthracyclines, it may present the cardiotoxicity in the dilated cardiomyopathy, even present even after discontinuation of the drugs. So we should be very careful. So it is cumulative, it is dose dependent, it can present even after the discontinuation of the medications, anthracyclines. So how can you identify the earlier morphological features of cardiotoxicity of anthracyclines? What is the earlier morphological feature? There will be swelling of endoplasmic reticulum. Okay, that is the first sign. Swelling of endoplasmic reticulum, followed by loss of cardiomyocytes. So this is called myofibrillar dropout. So these are the important earlier morphological features of cardiotoxicity of anthracyclines. So what are the symptoms of cardiotoxicity of anthracyclines? So they produce congestive heart failure, that you know. So the symptoms will present like exertional dyspnea. So you're running and walking, you will have breathlessness or exertion. Orthopnea. Patient on lying down, they will get breathlessness. So they should sit to relieve the breathing problem. So on lying flat, they will have orthopnea or breathlessness during lying down. And they can, and another important symptoms of congestive heart failure is peripheral edema. They can get pedal edema or peripheral edema. So now we have described about cardiotoxicity, important side effect of anthracycline antibiotics. Other than that, what are the side effects we can get? One important side effect is red color urine. Okay, it is not actually hematuria, it's just red color urine. You have to remember that point. And another important side effect is radiation recall phenomenon. What is that? Radiation recall phenomenon. At the sites of prior radiation exposure, you have received radiation at the previous time. Okay. Suppose you have received your radiation for some other treatment before. At these sites where the radiations are given, you will get erythema, that means redness of the skin, and desquamation of the skin. Skin will get desquamated at the areas of the prior radiation exposure. That is called radiation recall phenomenon. So remember these two important points, double R, red color urine and radiation recall phenomenon. They are the other important side effects of anthracyclines. Now I'm going to talk about Mitoxantrone. Comparing to all other anthracycline antibiotics, this seems to be less cardiotoxic, okay, comparing to others. So where it is used, Mitoxantrone, remember MAP, M-A-P, M for multiple sclerosis. It's a condition called multiple sclerosis. So it is in late stage, secondary, progressive, multiple sclerosis. In multiple sclerosis, there are a lot of types. So in this type, the late stage, secondary, progressive, multiple sclerosis, Mitoxantrone is used. Other one is AP, advanced prostate cancer, advanced hormone resistance prostate cancer. So in these two conditions, multiple sclerosis and advanced prostate cancer, the Mitoxantrone is used. What is this AML? AML is the side effect. It can produce AML. Even though it is less cardiotoxic, it can result in acute promyelocytic leukemia, which is one form of AML. It is M3 subtype of AML, acute promyelocytic leukemia. It can produce AML, promyelocytic type. Now we can discuss about the drug called Daunorubicin. Okay, Daunorubicin. So what is the drug of choice for urinary bladder carcinoma in situ? We used to give intravesical therapy of BCG. You know BCG? Bacillus calmette-guerin. Okay. We used to give intravesically for the treatment of urinary bladder carcinoma in situ. In case of resistance, we used to give Daunorubicin in that case. So intravesical therapy of BCG refractory urinary bladder carcinoma in situ, we used to give Daunorubicin. Now coming to dactinomycin. Dactinomycin is also called actinomycin D. Okay, remember, put the D at the last. So actinomycin D, we can also call it like that. So it acts, how it acts, the mechanism of action, it acts by inhibiting the DNA dependent RNA synthesis like rifampicin, your anti-tubercular drug. They also act by the same mechanism, by inhibiting the DNA dependent RNA synthesis. Okay. So where it is given, it is also given like Vincristine, we told it is used in solid tumors, Vincristine. So it is also used in solid tumors in children. Vincristine also used in solid tumors in children. So remember Vincristine here. So solid tumors in children, we have rhabdomyosarcoma. Rhabdomyosarcoma, it is a malignant tumor arising from skeletal muscles, rhabdomyosarcoma, and Wim's tumor and choriocarcinoma. Choriocarcinoma is a carcinoma arising from the placenta. Remember that, okay? So in these three conditions, we are using dactinomycin. And it is also a potent radiosensitizer. What is radiosensitizer? It will increase the activity of radiation. By giving these drugs, the radiation sensitivity will get increased. So it is a radiosensitizer like metronidazole and 5-FU. 5 you know 5-fluorouracil. It is also a radiosensitizer. Metronidazole, you know, anti-amoebic drug. So it is also a radiosensitizer. Now we are going to discuss about bleomycin. I told you, out of all these anti-tumor antibiotics, bleomycin is only CCS, cell cycle specific. It acts only when the cells are proliferating. That acts in the G2 phase by causing DNA strand breakage. And it also leads to free radical formation. Because of the free radical formation, it mainly affects two areas: skin and lungs. Skin and lungs. Okay, the side effects of the bleomycin in skin, we have cutaneous toxicity. Cutaneous toxicity, we have hyperpigmentation, we have hyperkeratosis, erythema, ulcers. These all takes place in skin. In lungs, we can get pneumonitis, we can get pulmonary fibrosis, we can get hypersensitivity and mucocutaneous reactions. So how will you identify the earlier indicator of adverse effect of bleomycin? There will be decreased in diffusion capacity of carbon monoxide. Diffusion capacity of carbon monoxide is used to measure your lung function. Okay, in particular conditions, it is reduced. One of the condition is using of bleomycin, because bleomycin will cause lung damage. In that case, the diffusion capacity of carbon monoxide will be decreased. So decreased in DLCO used to measure while giving bleomycin. So a relation of bleomycin with type 1 and type 2 pneumocytes is it causes necrosis or cell death of type 1 pneumocytes. So if the type 1 pneumocytes are necrosed, there will be compensatory hyperplasia of type 2 pneumocytes. Remember that. It causes necrosis of type 1 pneumocytes that results in compensatory hypertrophy of or hyperplasia of type 2 pneumocytes. So how bleomycin is metabolized? It is metabolized by the enzyme called bleomycin hydrolase. Okay, this enzyme, the enzyme concentration is very less in skin and lungs. So in these areas, in the skin and lungs, it cannot be metabolized much. That's why it gets accumulated and cause side effects. So skin, we can get cutaneous reactions, and lungs, we get pneumonitis and pulmonary fibrosis. A lot of things are happening there. So thus the major organs involved in the toxicity are skin and the lungs. Remember those points. So when the bleomycin toxicity may become apparent, when it becomes clear, remember, increased oxygen will lead to bleomycin toxicity. Okay. So the bleomycin toxicity will be apparent when there will be increased oxygen. So after exposure to transient very high PiO2, that is partial pressure of inspired oxygen, you will get the bleomycin toxicity will become clear or apparent, because the bleomycin dependent electron transport system is dependent upon O2, oxygen. So increased oxygen, there will be increased toxicity of bleomycin. The toxicity will become apparent. Now coming to the last drug of anti-tumor antibiotics, we have mitomycin. This mitomycin is also an alkylating agent. Okay, so where it is used, it is also used for intravesical therapy to treat superficial bladder cancer. Already told BCG. Okay, we used to give BCG, okay, in intravesical therapy. Like that, we can also use mitomycin for the treatment of superficial bladder cancers. Also, we can also give mitomycin for anal carcinoma with radiation therapy. Anal carcinoma also with radiation, we can give. For anal carcinoma with radiation, we can give mitomycin. Then, rarely it can produce a syndrome called hemolytic uremic syndrome that you will learn in pathology. Hemolytic uremic syndrome. So another best use of mitomycin is, it is the best available drug for use as an adjuvant to X-ray. It can be used as an adjuvant to X-ray to attack hypoxic tumor cells. To attack the hypoxic tumor cells, we can use as an adjuvant to X-ray radiations. This drug is converted to active alkylating agent by the process called reduction. So by the reduction, it is converted to active alkylating agent. Another important side effect is it can cause delayed bronchospasm, bronchoconstriction. Another important use is it is used in patients with tracheal or laryngeal stenosis. So these are the things with mitomycin. It is an alkylating agent. We can use for intravesical therapy to treat bladder cancer. We can also give for anal carcinoma along with the radiation therapy. Rarely can cause hemolytic uremic syndrome, and it is used as an adjuvant to X-ray to attack the hypoxic tumor cells, and it is converted to alkylating agent by the process called reduction. It can cause delayed bronchospasm. Particularly, it is used in patients with tracheal or laryngeal stenosis. So now coming to you should know what are the bone marrow sparing drugs, cytotoxic drugs. Whole anti-cancer drugs. Which drugs will not affect the bone marrow? That's the bone marrow sparing cytotoxic drugs. We have vincristine. Okay, we have vincristine, we have bleomycin, we have L-asparaginase. Remember VBL. So vincristine, bleomycin, and L-asparaginase, they will not cause bone marrow toxicity. So distinctive toxicity of bleomycin, we know pulmonary fibrosis, and it also affects the skin. So cutaneous reactions, hyperkeratosis, erythema, ulcers, it will happen with bleomycin. This bleomycin is bone marrow sparing. So VBL, the B is bleomycin. It is bone marrow sparing. It will not affect the bone marrow. So distinctive toxicity of anthracycline is cardiotoxicity because they produce semiquinone free radicals, which results in dilated cardiomyopathy and congestive heart failure. So distinctive toxicity of paclitaxel. The paclitaxel can produce hypersensitive reactions because they contain chemophore containing substances, and they can also cause peripheral neuropathy. For docetaxel, they can cause peripheral neuropathy along with fluid retention. Irinotecan is it can activate the cholinergic system. It will inhibit the enzyme called acetylcholine esterase. So acetylcholine will not be metabolized. There will be more acetylcholine. If there is more acetylcholine, there will be increased cholinergic secretions. So increased cholinergic activity will increase the secretions. The increased secretions, one of the examples is diarrhea. So vincristine is bone marrow sparing, VBL. Okay, so it is bone marrow sparing. So it will not affect the bone marrow. Important side effect is neuropathy, peripheral neuropathy, and SIADH, syndrome of inappropriate antidiuretic hormone activity. So these are all for the class. Thanks for the patient listening. Thank you so much. Kindly share.